Hey everybody, Menachem, Brodie here with you once again from HVTraining, your certified and experienced USA Cycling expert level coach, strength and conditioning coach, and postpartum corrective exercise specialist. Here this morning, happy Tuesday, we've got our Amsterdam mug, got some fresh coffee, very good coffee from first time ever from Congo. This stuff is amazing, I'm telling you. If only I could share it with you. So we can't sit together, but we can do YouTube Live. And today, this week, we're going to talk a little bit as a precursor for a USA Cycling coaching webinar tonight on women-specific training. And this is something I've been very passionate about for the last 8, 9, 10 years, is helping women in cycling, also triathlon, but much more so cycling, because there's so much misinformation out there, as well as women have different needs than men. And this is something that we know from research. Dr. Stacy Sims is somebody whom I follow very closely. If you follow the Human Vortex Training Facebook page, you'll see early this morning we set up or retweeted, reposted, whatever the verbiage is, linked a study that she just had posted about how that researchers can actually control for women partaking in their studies, because a lot of the stuff that we're reading about sports science out there and performance does not include women. They are looking at male subjects, usually in college. So tonight in my USA, or this afternoon I should say, in my USA Cycling coaching webinar, I'll put the link below after the video is done, the live video, so you can go over and sign up. We're going to be talking about postpartum specifications or postpartum changes that you're going to want to make as a coach or a rider to help you be able to get back to riding your bike. And one of the things I'd like to kind of get into today in our live right now is diastasis in cycling. Now this is something that a lot of people think only affects women, postpartum women, but that is not the case. I've actually had a couple cases of men in their mid to late 40s or 50s who had diastasis, and one of them was pretty bad. So there's a number of things that have to do with diastasis, but we're going to start even further back. And we'll get into this on the webinar tonight. And I know it's USA Cycling Coaches, but as far as I know, anybody can sign up. If you're interested, if you're a female, or maybe you're a husband to somebody who's trying to get back into cycling and you'd like to learn what they can do, sign up for the webinar tonight. It's either $29.99 or $39.99, and we'll give you the information that you need for the basics to get back into postpartum fitness. Now, the first thing we need to talk about when we're talking about women-specific training, returning from pregnancy, postpartum, a lot of doctors, and I saw this when I coached my indoor cycling class back in the US for the number of years. I also had a number of cyclists come to me postpartum where the doctor said, look, you can't run, you can swim and you can bike because they're low impact. But this is a big mistake, and it's something that I didn't know back then what I know now, and that is I was right. It's not a good activity just because it's low impact from running. It's not the amount of pressure that's on the outside of the body that matters. It's the amount of pressure that's inside, in the abdomen. Because as postpartum women will know, things in the body change, things shift. Aside from hormonal status, also physically, you're going to see changes in the body. Most notably, there's going to be some type of separation. It's something like 100% of women at their due date had a diastasis. This is a natural occurrence that we need to have. And something like, I think, 32 or 52%, something like that, 6 months out, still had some type of diastasis. And simply speaking, diastasis is just a separation of the linea alba. It's a connective tissue in our abdomen, and you can have different types of separation. You can have above the belly button separation, you can have below the belly button separation. This is where some women will have that bulge or the pooch. You can also have full separation all the way up and down, and each one is going to be a little bit different. So one of my mentors and someone I have a lot of respect for in the world of postpartum fitness is Dr. Sarah Duvall, and she has a great program. And actually what we'll do is we'll put a diastasis, how to fix your diastasis program. We'll put a link down below so you can get access to that. But what she talks about is in her experience in her 15 or 20 plus years as a physical therapist specializing in this, she has seen women and helped women heal diastasis that are 10 fingers wide. It's measured by fingers. So 10 fingers wide, and those that are actually also deep, where they're able to put their fists pretty much to their spine. Like, that's not normal. But the thing is that despite how wide or how deep it is, you can, with the proper treatment for you, heal the diastasis. Now, why are we talking about this with cycling? And how does this tie in to those females that came to me in my indoor cycling class or to me as a coach? Postpartum said, my doctor said it's okay for me to return, and then had issues. They didn't feel comfortable on the bike. The diastasis was getting worse. It wasn't healing. The reason is that it's the internal pressure that we are placing on the system that's going to determine how quickly a diastasis can heal or if it will heal. And there are many other factors, but this is one of the predetermining ones. The pressure we put on the inside. So swimming is actually not great. It can actually be worse than running if you have diastasis or prolapse. Same with cycling. If you're doing hard efforts on a bike, like the women that were coming into my indoor cycling for endurance athletes class, postpartum, 6-12 months, they were having serious difficulty, and they couldn't sit, they were having issues with diastasis, they were having pain, because the internal pressure from these high intensity efforts are what's part of the problem. When you have a diastasis, essentially what's happening is the abdominal wall is like, not my job, man, I can't do it right now. It's not functioning as it needs to. And there's actually a simple way that you can check for diastasis. You can lay down on your back with your feet bent, so feet are flat on the floor, you're laying on your back, kind of like you're sitting in a chair right now, and simply just lift your head up and try and push your fingers in between your six-pack, essentially. And you can check, and you want to check from the top all the way down to the bottom. And you can, if you have somebody else you trust, you can do it. You don't want to hurt yourself, but you can just gently push down and see, is it squishy, is it firm? And you want to go all the way down below the belly button as well, because that linea alba comes all the way down. And you can see if there is a diastasis, if so, how deep, and that's measured by how many knuckles down it goes, and also how many fingers wide is it. And this is an important consideration for those of you who are postpartum, because we need to understand, can you handle the pressures of getting back on the bike, as far as sitting on the bike, and also the internal pressures. So as we're sitting here talking, there are actually three considerations we have. There's three different things that need to line up for us to be able to regulate internal pressure well. Number one is going to be our head position. So a lot of cyclists tend to get into this forward head position, where the Adam's apple is kind of sticking out and the head is forward. And this causes a lot of stress onto the deep abdominals and decreases pressure in the deep abdominals, or it can decrease pressure because there's two other factors. Number two is going to be the diaphragm. The diaphragm should be domed. It should be able to press down as you inhale and push up and dome as you exhale. And this helps us be able to regulate pressure, because that's the middle piece, which is the pelvic floor. The pelvic floor should actually move in unison with the diaphragm. So in the diaphragm, and when you're inhaling, the pelvic floor should pull down, and when you're exhaling, it should kind of release up. And this is a problem that a couple of the women I had for the indoor cycling class, where they were drawing their stomach in and bracing their stomach the whole time. So they were actually weakening the pelvic floor, doing anything they could to get back on the bike postpartum because their doctor said it was okay, and yet they had all these issues. So it's very complex, and those of you who have come to me with these issues, remember what I told you. Well, it depends. I can't just give you a list of exercises because it depends on what your issues are. The 50-something-year-old man I'm thinking of in particular, he always had that doming or bulge whenever he lifted his head up. He said, I've never not had this doming. Whenever I do a sit-up, it always domes in the middle. Is that normal? I was like, so-and-so, that's not normal, and we need to look at that. So it's not just something that affects women, but tonight in the webinar, we are going to get into details about considerations that you need to take coming back from baby. And there's a number, from are you breastfeeding, or are you giving formula, or are you pumping? So some women say, I'm not breastfeeding, but they're pumping milk. The reason this is important is because when you're producing milk, you also increase a hormone called relaxin. And what that does is makes your joints a little bit looser, and that has a whole number of effects on the body and the hormonal system. If you've watched the HVTraining video on the 4 pillars of athletic progression, hormonal status is one of them. So building up the hormones' abilities in the bodies to deal with the stresses and to be able to repair itself is one of those things that we really need to make sure that we're building up. So there's so many different things when it comes to postpartum fitness that we have to think about, that you need to think about, and it's individual. So just because cycling is a low impact sport, and I know triathletes out there, I've had 5 or 6 at this point this year. We're in October, we just started October. So 5 or 6 is what, 1 every month and a half roughly. Hey, I'm a triathlete, I'm a new mom, I'm trying to get back, I'm having difficulty on the bike, I can't run, it's worse when I swim, what do I do? Well, let's get into some postpartum exercises and work on your breathing patterns. That's number 1, and posture, number 2. There's a whole bevy of muscles that we have to strengthen to help us have better positioning, as well as adaptations we need to make on the bike. I'm going to give you a couple considerations you should think about here, But if you want to get the full Monty, you have to sign up for the webinar. So if you missed this, if you're watching this after October 2nd, 2018, you can go to usacycling.org. You can go to webinars that have been archived, the library, and you can still purchase the recording. Now, I encourage you, come tonight, October 2nd, or this afternoon rather, it's 11 a.m. Mountain Standard Time, which I believe is 1 p.m. Pittsburgh time. So make sure that you're on there live, because you'll be able to ask me questions. And this is what I'm actually leaving more time for tonight, because the answer to most people is it depends. And even then, you may ask me a question, I may say, you know what, we need to do an assessment, or I'm not the right person, you need someone that's in your city or region that you can go to and physically see. So let me find out how I can hook you up and get you set straight. But the considerations we want to think about postpartum, returning to cycling. Number one is we have to think about posture and the strength of our deep abdominals as well as our pelvic floor. So if you have any type of diastasis, it is not a good idea to get back on your bike and do hard efforts. If you have prolapse in diastasis or prolapse, it may not be a good idea to get on your bike at all quite yet. And yes, I know that's extremely limiting, because you can't run, you can't swim, you can't bike. And doctors may say to you, well, you can swim. There's external pressure, and swimming I found is much harder to regulate the internal pressure, because you have to breathe as well and hold your breath, and that can cause more issues. But you can use perhaps a recumbent bike. You can also possibly use an elliptical. This depends on where you are and your ability to maintain core pressure and work with that. So that doesn't mean you can get on and do high intensities, but it does mean if you have slight diastasis with no signs or symptoms, but you notice that it's there, you can do low intensity cycling. I strongly recommend that if you are going to do this, number one, always be assessed by a professional. You want a physical therapist who is a pelvic floor specialist, or you can work with a pelvic floor or a postpartum corrective exercise specialist to help you figure out what you are and are not capable of doing. But you can go at endurance. So if you're cleared, you don't have any problems, you have a little bit of diastasis, it's healing on its own, we want to keep it at endurance, and we need to make sure that we're doing deep abdominal and postural exercises that are going to help you. Now, I know it's been going on for the last couple of years on Instagram. 1,000 sit-ups a day helped heal my diastasis. I'm very questionable about that. Doing 1,000 sit-ups a day or 1,000 crunches a day, whatever it was, you can correct me below if you want, isn't necessarily going to help. In fact, it may actually make it worse. The same goes for planks, side planks, push-ups, crunches, bicycle crunches, V-ups. There are all these different front-loaded exercises, goblet squats. All of these things can actually make the diastasis work. So how we need to deal with this is, number one, you need to be assessed by a specialist. So a physical therapist who's a pelvic floor specialist or a postpartum corrective exercise specialist. Very, very important. Once you've been cleared for that, and we know that you can handle and you're learning how to modulate that pressure and line up those three important rings, the bottom of your mouth, the diaphragm, and the pelvic floor. Once we do that, we're going to make changes to your bicycle. We're going to make it so that your road bike is as non-aggressive as possible. We're going to have you sitting upright where you can rotate that pelvis forward, so we can keep those rings nice and lined up, which is very important. So we want to rotate forward, not rounding forward, because now we've lost that line. So we don't have a can or a cup, if you will, straight. Now it's kind of bent at the top. So that's number one. We're going to bring those handlebars up. We may even get you a stem that brings you up. We're not going to go crazy. We're not going to have you riding on a zebra, or not a zebra, on a giraffe, neck kind of stem, but we will bring you out of that aggressive position. So your differential, for the difference between your handlebar height and your saddle height should be at most 0. If anything, it should be above that. Time trial bikes, not until we get you all set up. We work on your breathing patterns, and that's number 2. So number 1 is we make the bike as neutral as possible. I used to say vanilla, but someone pointed out vanilla gets a bad rap. What if I like vanilla? So we'll say a Neapolitano, where you have chocolate, vanilla, and strawberry. We're going to make your bike as Neapolitano as possible. So everybody has a flavor in there. We're going to make it neutral. The second thing is we're going to work on breathing patterns. And this is something that, if you've been paying attention to the Human Vortex Training YouTube channel here, if you've liked and you've subscribed, you saw last week we uploaded the hands overhead breathing. Now this is something that most people don't feel when they first do it. When we cue them and we say, are you making sure that your back is staying flat against the ground? Activating your abs just a little bit. Breathing in through the back body. So breathing into the upper, between the rib cage. Are you relaxing your chin? Are you tensing the chin? Are your arms nice and tense, or are they nice and relaxed? These are the small things. So go ahead and click over when we're done here. Wait till we're done. Don't leave yet. Wait and click over when we're done to try that hands overhead breathing and see what it feels like. And what we would want to have is we want to have nice full rib expansion. And we also want to have the pelvic floor expand as well. And that happens through breathing in through the mouth, thinking about feeling the mid-back and really relaxing everything. And then breathing out from the bottom up. And this is an important skill to learn, especially as a cyclist, when we're in that aggressive position. And I even coach this in my How to Sit on a Bike Faster, to Ride Your Bike Faster video, which has like 250,000 views. When I uploaded that, I was teaching belly breathing, and I knew that the women that I had who were postpartum had issues with this, but I'm making the video for the masses. So just belly breathing can actually be detrimental for you if you're postpartum, because we need to teach you to also expand the ribs, and also for cyclists across all age levels now. So I coach belly breathing mostly when we're in hard efforts or climbing, because we tend to get that fight or flight, which is good, but we also need to get the back of the body to expand a little bit. So I've moved up from the belly breathing up to back body expansion breathing, which actually has a fantastic impact. But what does this all mean to you, and how are you going to take it right now if you're not able to attend the USA Cycling webinar at 1:00 p.m. Eastern Standard Time today? What are you going to be able to do? Number one is check out your bike fit. Make sure that you're as neutral as possible. So if you have a really big differential, more than 0, we want to bring you up as much as possible so that you're able to keep your head, your rib cage, or your diaphragm, and your pelvis kind of rounded forward as opposed to rounding the back and the head forward. That's number one. Number two is keep it at endurance. And remember, before that, we want to be assessed by a pelvic floor specialist, postpartum corrective exercise specialist, or a pelvic floor PT if you're having diastasis and it's not quite healing. Number three is, remember, just because a doctor tells you you can go and swim or you can go and ride your bike does not mean that it's a great idea. Not everybody is going to be different, because every body is different. So just because you had a friend who was back out riding hard 6 months postpartum after her third kid, and she was able to do it after each one, does not mean that's how your body works. So it has a lot to do with the predisposition, the imbalances you have before the pregnancy, how the pregnancy goes. Do you have any scar tissue? Do you have any prolapse? Do you have C-section? Do you have an easy delivery? Do you have a hard delivery? There are a lot of different considerations that we have to take. And then outside of that, we have to build up your training plan a little bit differently than we normally would. So these are some of the things we're going to talk about. It's only a 1-hour webinar, so we're going to pack a ton of information into this, including diastasis, prolapse, do certain surgeries carry, should you think about having a certain surgery? Does it carry the results that the doctors are telling you? So we're going to talk about all these different things, and we're going to share a lot of different resources, because ladies, there's so much science out there when it comes to sport performance, but unfortunately, up until the last maybe half decade, not a lot of it has been focused for you and helping you be able to return. So we're going to give out a couple different studies that you can read that will help you get the gears turning, as well as get you a link to Dr. Sarah Duvall's course on how to fix your diastasis. And once again, it's always best to get assessed in person, but her course is fantastic, and I find that a lot of the women with diastasis, when we get you on the right path, working on correcting your breathing patterns and working on the appropriate exercises for you, including muscles in the mid-back, including the serratus anterior, which we'll talk about tonight, and what has a role. We also have a blog post coming out this week on stretching. Does it resolve pain? So that's going to be really interesting as well. And I'm also going to have a post that I've been kicking around for the last 3 or 4 years, but having worked with a couple professional, semi-professional athletes, I think that it's time to post it. I'm going to revise it one more time, but it's about those of you who are serious racers. So we're talking about you're racing Cat 3 or Cat 2, Cat 1 professional or UCI professional. There's a lot of identity searching after or when you realize you're coming to the end of your career. And there's actually a great book. Where is it? There's actually a great book that I've recommended to a number of the professional cyclists worked with who are coming towards the end of their careers, called Without a Job, Who Am I? And this is by Dr. Abraham Twerski. And he's a very well-known psychiatrist. He is known around the world. He is an addiction specialist, but this book, it really hits home. So Without a Job, Who Am I? And this really ties in not just to cyclists and triathletes, but also to any professional or semi-professional athlete. The number of athletes I've worked with who have made it to the high major leagues, I can think of 3 baseball players, hockey player, there's a couple others. It's a real identity crisis when they get to that point where they realize that they've kind of hit the limit, or they realize it's time for them to move on because they're not going to get to that next level. And this is really important, and this is separate from the women's presentation tonight, I know, but it's something that, as you can tell, I've turned more serious because I'm thinking about these individuals and how hard it was for them. And this can also be after a serious accident. For those of us who know people who've had serious cycling accidents, Danny Chu is one of them in Pittsburgh. He is a Pittsburgh legend, and just in classic Danny Chu style, you'd think he'd be devastated. He's certainly hurt, but he's so happy just to be on the hand cycle, and you can't kill that spirit. So he's been paralyzed from the neck down from a biking accident where he just blacked out one day and fell into a gutter in the middle of Ohio. But the point being that a lot of us as cyclists and triathletes and endurance athletes, a large part of who we are is tied to what we do. And while it may not be our job, it kind of is, because that's who we are. We're a cyclist. I know that I struggled. I picked up this book when I had my hip injury, and I was really struggling. I'm like, how can I be a cycling coach and not be able to ride 50, 60, 80, 100 miles with the guys and ladies like I want to, like I feel I need to? And that's when this book was introduced to me, and by a good mentor of mine, a really good friend as well. It really helped me be able to realize that just because we're cyclists or triathletes or runners or we're professionals doesn't mean that that's what our identity is. We are far more than our jobs or our riding. So that's the YouTube Live for today. I know it's kind of different things than what you might expect a coach would talk about. You'd usually expect gear or tech or training tips. I kind of do all that a little bit in strength training exercises. I kind of do all that with the regular videos. So for these YouTube Lives, I want to try and give you that bonus, that extra. These are the types of things that me and my athletes that I work with around the world will talk about during our phone sessions or our Skype sessions. We talk about all types of different stuff. I have riders that are going through different stages in life. One rider's getting ready to go to Europe, the other isn't sure if they're going to go to Europe or stay in the US. I have 2 riders like that, actually. So there's a lot of different things that happen in our lives that we need to be able to think about as coaches and as athletes and be able to mitigate and also be able to balance. And postpartum fitness is definitely one of them, because you have a whole new world and a whole new world in your hands and a whole new world around you, because everything is going to change. And it depends on how you look at it, but I like to see all the moms that I've worked with, the new moms, have always come out way better than they were before they went in and had that new gift given to them. And that's what we're going to talk about tonight. So 1 p.m. Eastern Standard Time, or this evening, 1 p.m. Eastern Standard Time today, October 2nd, 2018, usacycling.org. Look for the webinars. It's under the coaches segment. As soon as we're done with live, I will put a link down there, as well as a link to Dr. Duvall's Fix My Diastasis program. So lots of great stuff for here on HVTraining. Make sure you like and subscribe, and we will see you probably next Tuesday, but let's see if we can't get a couple YouTube Lives out on the road the next couple of weeks. If you have questions or you found anything here to be very beneficial or very useful to you, please like and comment below. Let me know how I'm doing. Let me know what you want to hear about on our Facebook Lives. It literally is me, you, a cup of coffee, my bookshelf, my plants. That's about it. We'll talk bikes, training, and how to balance everything. So until next time, remember, train smarter, not harder, because it is all about you. Pinky. All right, I'm going to shut you guys off and get out of here. Okay, love you, bye.